This is the short story of CHIVA and its hemodynamic principles. The CHIVA story is why preserve the saphenous vein in the varicose vein disease. We have two paradoxical responses: to preserve a vein eligible for an eventual life-threatening arterial occlusion, and to preserve a vein in order to reduce its varicose recurrence. Saphenous vein for peripheral and coronary bypass avoid amputation and save lives. As young vascular, I was upset by few, nevertheless too many, patients not eligible for a vital venous arterial bypass because of previous saphenous ablation. This varicose man life was saved by saphenous coronary bypass 15 years ago. It needs now a left leg arterial bypass for severe arterial occlusion. This is why I decided to find a treatment that combines the cure of the varicose veins and the conservation of the saphenous vein against the 120 years old destructive dogma. I analyzed the academic pathophysiology and found a great lack of hemodynamic concepts. Thanks to Doppler ultrasounds, I could understand better the venous hemodynamics, and I proposed new concepts of the venous pathophysiology that led me to the conservative surgery of the venous disease named CHIVA. The venous circulation was discovered by William Harvey, but he was, as usually, challenged by all the great physicians of the time. The CHIVA precursors are those who had an hemodynamic approach of the venous system, and for the treatment also, especially with Benjamin Brady, Friedrich Trendelenburg, and Clemens Perthes. Destructive treatments are based on varicose-centric theory. It began with the stripping of Mayo and Babcock, but it is still alive today with other methods as radiofrequency, laser, foam, glue, and stripping. On the other hand, conservative treatments are based on hemodynamicocentric theory, but unfortunately they died in 1899 with Brody and Trendelenburg, who performed saphenous ligation without destruction. It was overlooked for 90 years. Fortunately, maybe, it was born again in 1988 with CHIVA. I was very lucky enough to be involved at the very beginning of the ultrasound adventure and participate to technical research and clinical application as a young angiologist. I published my findings regarding the Doppler semiology of vascular disease in the first World Book of Doppler vascular semiology. Then I patented a device that made possible for the first time in the world the echo imaging of the superficial veins on artery. This device gave a sufficiently good imaging to make me write the first full book also of ultrasound vascular imaging. This background made me easier the checking and revisiting the venous hemodynamics that led to CHIVA. You can see here all the books and the dates, preceded dates here. A mix of echo-Doppler skills, hemodynamics study, and large clinical experience made me understand better the venous pathophysiology, which made me revise the classical concepts and propose new ones. These new concepts are based on the central role of the transmural pressure in the venous function of drainage and cardiac filling, and the hemodynamic process that regulates it. The vein preservation is logically based on these new hemodynamic concepts. Any varicose vein is the victim, not the cause of the venous insufficiency. Its draining function is disturbed by a correctable hemodynamic disorder. That is CHIVA, the French acronym for conservative and hemodynamic treatment of the venous insufficiency in outpatients. In outpatients because it is a mini-invasive surgery. Vein ablation is to throw the baby with the bath water because it destroys both the physiological draining function and the vein, victim of CHIVA curable hemodynamic disorder. All the studies, trial and RCTs, validate the CHIVA as the better than ablative procedures, surgical or endovenous. 107 articles and 9 books are published on CHIVA treatment. Before vein ablation, patients should be informed that they are losing the bypass for eventual threatening arterial disease. Indeed, the saphenous veins are eligible for arterial bypass even if they are varicose. This is conferred by companies like Bioprotec in France, who collect stripped varicose veins and sell them as an arterial bypass for other patients. Unfortunately, this information is most of the time not given to the patients, which is contrary to the informed consent, ethics, and laws. Ablation and CHIVA play on the same venous system board, but ablation obeys the simplistic checkers rules and CHIVA the complex chess rules. As the venous function is complex, ablation doesn't fit the treatment of the venous dysfunction. The learning curve is steep, but the result is worth it. All this has not been possible without the support and guidance of my pupils, students, and collaborators over the past 30 years. You can see all of them here and here for very different countries over the world. The CHIVA expert international meeting began in 1988 with the publication of the book. Then we had CHIVA Experts International meetings every 2 years since 1988 in 8 different countries: France, Italy, Germany, Portugal, Spain, Argentina, Morocco, and China. Thank you very much for your attention.